Uh, Hello friends, I am Dr. Ankit Madharia. Today I'll be showing you how we give an intradiscal ozone injection. Our patient is a young female who complains of back pain and bilateral knee pain since past 1.5 years. Uh, Today we got her MRI done. The MRI essentially looks normal, but you can observe over here that all the discs are well hydrated except this L4 L5 disc, and also this is slight bulge on this disc. So we can make out that there is a degeneration process going on in this disc level, which may be the cause of her back pain as well as knee pain, because the L5 nerve, L4-5 nerve roots supply around the lateral aspect of knee, and that's where the patient has complaints of pain. So this is our MRI findings, where you can see there is not much of compression, but there is degeneration of the disc space. The disc is black, and it is a good case to do a discography, and if the discography is positive, we can inject ozone into this disc level. These are her other films. I'll show you. So you can see here that all of the other discs are well hydrated except this L4 L5 level, and this corresponds to her symptoms, the region of back pain, and the back pain is more on flexion, it reduces of extension, so it points more off towards discogenic back pain. And back pain in young patient who cannot stand for more than 10 minutes is more likely to be discogenic. So these are our images, and you can see that in axial view also there is not much of compression here, although there is loss of concavity at this L4 L5 level, but the nerve roots are essentially free. It is just the disc space is bulging, but it's not compressing too much. So the treatment of choice in these cases would be either an intradiscal PRP, ozone, or a steroid injection. I prefer to use ozone right now because it has least side effects, and I can repeat it many times as much as I want, and it is economical. It's very cheap. It's just oxygen which goes through the machine, and there's nothing which gets consumed, and very less chance of infection. So we'll do ozone in this patient, and we'll see how the result comes. Thank you. So in this patient we'll be giving an L4 L5 ozone intradiscal injection. So we'll be going by transforaminal route. For people who may not know this, transforaminal route means we'll go through this foramen. This is the transforaminal area through which we'll be going into the disc. It is an area in which we'll be going through the Campbell's triangle. Campbell's triangle is formed by the exiting root and the traversing root and the lower disc margin. So we'll be going through this safe triangle under the superior articular process over here, and we'll be going directly into the disc. And it is very safe, can be done under local anesthesia, and this is the oblique that we'll be going. Okay, so this is not direct posterior, and the nerve roots are very safe. This will be done under C-arm guidance. So I'll show you now how we'll do the transforaminal injection. Thank you. Hello friends, I am Dr. Ankit Madharia, and today I'll be showing you how we give an intradiscal ozone injection for discogenic back pain. So this is a 22-year-old female who has complaints of back pain since past 1.5 years. On MRI, there's a black disc at L4 L5 level without any much significant compression on the traversing or exiting nerve roots. So we have decided to give a trial of ozone in her intradiscal region, and I'll show you what is required for giving the ozone injection. Please bring the camera. Idhar le camera. Isko dikhao kya hai. So what we need is, this is a 21 centimeter needle which we use for transforaminal endoscopy. This is 10 cc of local anesthetic. I use Loxicard 2%. This is 2 cc of depomedrol, that is methylprednisolone injection, which we will give in the epidural space. This is iohexol dye, which we will use for doing discography to confirm the origin of back pain from L4 L5 disc space. And this is BD syringe, in which we will use to fill the ozone. We will use 10 cc's of ozone for intradiscal injection. So this is a BD syringe. This does not have that rubber at the front, so ozone does not react to it, and this is the only syringe which is compatible with ozone injections. So we have done prepared the back under all aseptic precautions, and first what we will do is from this side. Idhar aa ja. We will give local anesthetic to the skin before starting the procedure. So I am starting about 6 centimeters from the midline. एक सुई लगेगा दीदी, बस. I am giving local anesthetic to numb the skin and subcutaneous region. बस. While the skin is getting numb, I will fill in the ozone into this syringe. So we'll set it in 1/16. So this is the flow rate that we want to achieve. अब इसको चालू कर दीजिए. Okay, so now this machine is making ozone. From here the ozone is coming out. We will just attach our syringe over here, and you can see that it will start filling up the syringe. I would usually need 10 cc in a single disc space, but I'll fill up to 15 ml in this case. That's it. ऑफ कर दीजिए, ऑफ कर दीजिए, इधर को भी ऑफ कर दीजिए. So this is our ozone. I'll put my finger here so that ozone does not flow out, and I'll put a cap here so that we have our sterile ozone in this syringe. So now we can start with our needle. कमर में एक सुई लगेगा दीदी. कोई भी तकलीफ होगा तो बताइएगा, हिलिएगा मत, ठीक है? मुझे कोई तकलीफ तो नहीं? ठीक. एक सुई लग रहा है, कमर में थोड़ा दर्द हो सकता है. सियाम को दिखाते रहो. कहीं कोई दर्द तो नहीं हो रहा? थोड़ा सा भी ज्यादा? हल्का है? पैर में कोई दर्द तो नहीं है? ठीक. लैटरल व्यू प्लीज. हाँ, कमर में दर्द हो रहा है? अभी यहाँ कोई दर्द? हमेशा जो दर्द होता है यहीं पे होता है क्या? इसी जगह के आसपास? अभी जो दर्द हो रहा है वैसा? कहाँ दर्द हो रहा है?
आप लगा रहे हैं.
जो कमर में दर्द होता है वो ऐसे ही होता है?
हाँ.
इसी जगह पे होता है?
हाँ, कभी कभी वहाँ होता है. मैं आपको बताऊँ वहाँ.
एक ही करिए. ठीक है दीदी, वैसे ही रहिएगा. So our needle is into the disc space, L45 disc space. Now I inject some dye to do discography. This is iohexol dye, and we'll inject and we'll see how is the pain. अभी मैं सुई लगाऊंगा, कोई दर्द हो तो बताइएगा, ठीक है? हो रहा है दर्द?
हाँ.
You can see the dye is leaking into the right foramen. उधर जाके zoom करके दिखाओ. Can you see the dye that is going into the disc is leaking also into the right foramen? So it shows that the disc is degenerated. Patient has concordant back pain, and अच्छे से zoom करो. हाँ, very good. Patient has concordant back pain and the dye is leaking. So this is the culprit. So we need to inject ozone into this space. अभी दर्द कैसा है?
अभी यहाँ पे नहीं दर्द है, घुटने में.
हाँ, घुटने में हो रहा है ना? ठीक. अभी एक ओजोन पे इंजेक्शन लगाएंगे, ठीक है? थोड़ा भारी भारी लगेगा. इधर देखो. So I have connected ozone and we'll be injecting slowly. I will inject about 10 cc and we'll wait. And we'll see in the there. So now we will withdraw our needle into the epidural space. Right now I am sitting at the epidural space, so I'll inject Depo-Medrol there. So this paraganglionic injection will relieve her radiating pain, and the ozone injection will relieve the back pain. Okay, we are done here. So this is the process how we inject ozone injection, and as you can see it is very much pain free. The patient is very comfortable without any sedation under local anesthesia, and this procedure can be done in less than 5 to 10 minutes. Thank you for watching. कब से आपको ये तकलीफ हो रही थी, क्या क्या तकलीफ हो रही थी? और
ये रीढ़ की हड्डी में प्रॉब्लम था, दोनों घुटने में प्रॉब्लम था।
अच्छा, कब से ऐसा तकलीफ हो रहा था?
1.5 साल से।
कमर में ज़्यादा दर्द रहता था कि घुटने में ज़्यादा था?
कमर में।
अच्छा, इसके लिए आज हमने MRI आपका किया, तो उसमें L4 L5 में डिस्क में थोड़ी खराबी दिख रही थी, लेकिन ज़्यादा दबाव नहीं था, है ना?
जी सर।
तो उसके लिए अभी हमने आपका ओजोन इंजेक्शन लगाया है L4 L5 डिस्क में।
जी सर।
तो अभी कैसा है दर्द?
अभी ठीक है, दर्द नहीं
कुछ
कर रहा
पता जो पहले होता था वो कुछ हो रहा है अभी?
है। हाँ, नहीं।
पूरा जीरो लग रहा है?
हाँ।
अभी 10 मिनट ही हुआ है ओजोन लगा के ना?
जी सर।
अभी कोई दर्द नहीं हो रहा?
नहीं।
घुटने का दर्द कैसा है?
घुटने का भी नहीं कर रहे हैं।
हल्का हो गया?
हाँ।
कोई कमर में जैसे हमने इंजेक्शन लगाया था उसमें दर्द ज़्यादा तो नहीं हुआ आपको?
नहीं।
कुछ पता चला ज़्यादा?
नहीं, थोड़ा दर्द किया, ज़्यादा नहीं किया।
ज़्यादा नहीं किया?
नहीं।
अभी कोई प्रॉब्लम तो नहीं हो रही?
नहीं हो रहा है।
संतुष्ट हैं?
हाँ।
ठीक, थैंक यू।